So at Primary Children's in our NICU, we see a lot of a really wide variety of patient populations here. And that's because we take patients from all the surrounding states because we're the only level 4 NICU in the area. So that's really cool. We see patients that go on ECMO that basically, if you don't know what ECMO is, it's like heart lung bypass. They do all the things that the hearts and the lungs do for you. We see patients with congenital diaphragmatic hernias where there's a hole in the diaphragm and all the abdominal contents go into the chest. So we have to treat that and then treat the lungs because they took up all the space. We have patients with gastroschisis where their abdomen didn't fully form, so their intestines are on the outside, which is kind of crazy, but it's really cool when when you're the nurse taking care of that patient. We see patients with tracheoesophageal fistulas and esophageal atresia where the esophagus might connect abnormally to the trachea and then it's not completely connected to the stomach. So we have to do surgical interventions for that. Another big one that we see is bowel perforations. And that typically happens when a patient is born prematurely and their bowels are just so fragile. And we start feeding them, maybe at their home hospital, and it's just too much and it perforates. So then they have to come here, they have to do surgical intervention, and then they stay here to recover from that. Whether it's that they're closed up right away or they have to get an ostomy and kind of work through their time with the ostomy, and then we take that away before sending them home. So it's really cool being able to see all these different things, and there's a multitude of other things that we do, but those are some of the big things that we see here, and it's really awesome to be able to work your knowledge on different patients and learn new things constantly. That's something that is incredible on my unit.